The whole perspective of changing from BDS to MHA was to get that global outreach. I wanted to travel. There are travel opportunities when it comes to working with corporates, interacting with a lot more people outside just your dental zone.
Yeah.
So I always wanted to become a doctor. Okay, it wasn't like I wasn't very specific कि मुझे MBBS करना है या BDS करना है. I wanted that doctor title in front of my name. My family dentist kind of influenced me, I feel, because just going to his clinic so many times, I saw the kind of work that he does and the way he interacts with his patients and how he has no emergencies. If you say that something's hurting, he'll be like, हाँ ठीक है, कल we'll book an appointment. It's not necessary that आज ही. Then there's a lot of skill also involved, na? And I also like art. The one where I say to him that अभी तो शुरुआत है, अभी तक तुम्हारा गोल्डन पीरियड चल रहा था. इसके आगे क्या होएगा?
Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast. Our guest for today is Dr. Unmesha Nerkar. She has finished her Master of Science in Healthcare Administration program from University of New Haven, USA after completing her BDS from Navi Mumbai. Dr. Unmesha is currently the project manager in a digital health platform company. The audio podcast is available on Spotify and Anchor. The links to that in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Unmesha, how did MHA happen?
So MHA happened after going to one of the conferences and realizing that there are many more, corporate medical companies who give you the opportunity to go global.
Right.
With a different management perspective. So it doesn't have to be, just a plain MBA. So MHA, because it is like MBA, but in a healthcare perspective.
Right.
That's why it came about to be MHA.
So you're talking about the dental shows which happen, like the dental conferences like WDS and all that.
Yes. So I had visited one of them and I had met with a person over there who was also a doctor.
Okay.
And he had done MHA and was now, at that time, was working at a very, very good position for marketing in a very renowned implant company. And the kind of contacts that he had and the kind of work that he was doing,
right,
it just felt like something that I want to do, just for that global approach.
Okay.
So
when you spoke to that person, you actually saw yourself doing that, or going globally, not sticking to one place. Did that attract you, or there were more reasons than that?
That is one of the reasons that attracted me, because I did not see myself to be confined to one particular dental clinic.
Okay.
So being a dentist, obviously, I love the clinical side of dentistry.
Okay.
And I do miss practicing sometimes. But the whole perspective of changing from BDS to MHA was to get that global outreach. I wanted to travel. There are travel opportunities when it comes to working with corporates, basically. Right. That interacting with a lot more people outside just your dental zone.
Yeah.
So right now, my network consists of all my friends who are dentists, all my corporate colleagues who are into marketing, who are into operations of different healthcare organizations altogether.
Right. So it's like best of both worlds.
I'm trying to get that.
So you did your MHA from New Haven University. Yeah. How was that experience?
So University of New Haven, Connecticut was good. Overall, the experience was great. The courses were good to select from.
Okay.
We had a choice of, certain elective topics, certain core subjects that we had to do. So overall, it was a good experience.
So was doing MHA at New Haven the only option, or you had more options with you? And if yes, why did you choose New Haven only?
So I did have more options.
Okay.
I had got into 3 other universities. But the reason I chose University of New Haven is because a few courses are also integrated with Yale.
Okay.
So when it comes to internship or when it it comes to doing some volunteer work and all, we were also associated with Yale.
Wow.
So that is why I chose University of New Haven, because we were literally in the vicinity of 10 minutes. So the Yale campus and our campus was like 10 minutes.
So you got an opportunity to work there also?
Yes, like not exactly work, but it was always under a collaboration. Yes. So it was a plus point that I thought it was, and the accreditation is good and the coursework was good.
And how was the university? Campus and everything, the studying part?
University was fun because it's so much different than India. No? Like your master's students, in a university, there are undergraduate students of so many different fields.
Right.
And then there's master's students of so many different fields. And from all over the world. So you're not just talking to Indians. I made really great Nigerian friends.
Wow.
So the overall experience was very good in the university. They had that, fitness is something that our universities in India don't really focus on. But over there, they really had like this one full rec center with like 3 basketball courts and a track in the middle of that. And it was insane. Like you go there and you're just like, wow.
Are you still in touch with all your friends back from New Haven?
Some of them, yes.
And how was the teaching experience? The student experience, the program, the way it was taught. Did you? Because it's who I've spoken to, it's a drastic change from India when you go abroad, studying in college, anywhere outside India. So how was your perspective on that?
Firstly, it is more practical based. So rather than just writing assignments and just reading and just researching, writing assignments. It was more like you go in depth of what, say, for example, there was a credit course of law and policy.
Okay.
So now being an Indian, we don't know anything about the American law and policy. But over there, we actually had to dig deep about what it is, how it works. So understanding that whole US healthcare system was something that we had to do from the scratch. So that research base wherein you're digging deep to know more about everything. Then it also included internships, which you actually had to find. It wasn't like, okay, somebody will tell you, हाँ इधर जाके internship कर लो. So that research goes into that also. Okay, how are you going to find? Who are you? You learn to network for what your interests are. Then you get something out of that. So more practical than theoretical is something that my experience was.
So what was the best thing you learned there?
I feel like the best thing I learned over there was respect. That the kind of respect that you give to each and every individual, regardless of them being at a specific job, or whether it be a professor or whether it be an undergraduate student or a janitor. You need to hold the door for everybody. You need to say thank you. You need to say please for everything. That is something that we don't do as a common practice in India. Right. So that is one of my biggest learning over there.
So giving respect to everyone, irrespective of who they are, what they are.
And they do get offended if you don't give them respect.
Has there been any instances where you have faced such an issue where initially you did not give respect? You didn't know that was a culture there.
And it was mostly, I think, it was only once, but it was about...
So what happened?
Holding the door,
Okay.
So like how we have a habit of just like pushing the door, walking through, and you're not looking behind who's coming or who's not. So one time I just went in and this lady thought, she was like, how rude is that? I was like, okay, I'm so sorry. I didn't know. But yeah, that is something that, it makes a big difference over there.
Got it. So what's the difference between studying in India and studying in the US? One major difference. Apart from, doing the whole research thing, apart from that, anything specific, just the approach or the way they look at things?
See, the approach is practical. Okay. And I feel like for us Indian students, it will make a bigger difference because, independence of learning, you are responsible for your own decisions. You have to manage your own studying. You have to manage your own khana pina. Everything needs to go. Everything. So I feel like that responsibilities that you gain as a student when you reach over there is something.
You become more independent.
Any day, yeah. I certain things that you never thought that you would. I think that if I would have not gone over there, there are certain things that I should still not be doing, which I do.
Okay.
Makes you more organized.
Got it. if given a chance, would you do this program again, the MHA program?
Yes, I would do it again, but with probably a little more focus on. I focus mostly on marketing. I would say I would have focused a little more on the other aspects also.
Did you have an option of doing something major in certain particular subjects?
So there were certain core subjects and certain elective subjects.
Okay.
So core subjects included the main HR and law and policy and all of these things. But electives were something that you wanted yourself to major in. So in that we could choose. So
what did you choose in?
I chose marketing.
Okay.
I chose health information systems. So it just gives you more knowledge about the electronic health system in the US because you're studying there.
Right.
And healthcare in US is so complicated if you go to see.
But why complicated?
I mean, they have too many layers, I feel.
Okay.
The
protocols or
protocols
the system?
Protocols, policies are very specific and strict. Like India, I feel we have insurance is a option, wherein you have insurance, acha theek hai. You don't have insurance, but you can still afford it.
Right.
Over there, you don't have insurance, you can actually go bankrupt with one procedure.
Isn't that crazy?
It's insane. But it is what it is. And so that's why I wanted to learn more about that. And so hence all of these majors were taken.
So, you were there for a couple of years. So one good thing and one bad thing about, New Haven as a town and a city, your experience?
New Haven as a town, good thing was that there were ample of Indian students, I would say, and a lot of Indian stores and Indian restaurants. So that was something that was good.
But isn't that something which you don't want when you go? Like you want to.
Initially, you don't want. First 6 months, I ate so much American food.
Yeah.
Oh my god! But then after that, you're like, nahi yaar, dal chawal. So yeah, it did help that.
So it's got a good Indian Asian community back there.
It has a good Indian.
And one bad thing?
It's not very social. So,
it's more laid back.
Thoda laid back because it's not like the city.
A country like.
Achha. So since going from Mumbai with the kind of social life we had with our friends around, suddenly you have to make your own friends, and then jitne bante hai, you're like a very close knit circle, and your social life becomes a little slow. So that is something that was. I feel like it wasn't bad as such. I mean, I feel like it was needed.
Yeah.
You couldn't do both.
Only when you lose something, you realize the importance what you've lost.
Yeah.
So you also currently you're working in a digital marketing in a company. So what do you exactly do in that?
So basically, I help pharmaceutical companies to kind of market their products on a molecular and scientific level to doctors.
Okay.
So how it works is like, say it's a community like Facebook, wherein on Facebook only doctors are present.
Okay.
And these doctors are coming from different specialties. So since pharmaceutical companies in India do not have the right to actually market on, say, television or any other print media, what they do right now is the only option that they have is MRs that go to the doctors specifically, and then they market their product.
Right.
But when you think about it logically, one MR at a time in a day could only reach, say, 25 doctors in a day. Not more than that. You can't expect him to do that. But what happens with digital marketing for these pharmaceutical companies is that you get a specific content from them. Okay, so they make videos, we can make videos, articles, or any kind of digital media that you want to. But since it's a doctor community, marketing to that particular community is okay by law.
Okay.
So what these guys do is how webinars are created. So they sponsor webinars where specific KOLs will speak. They get collaborated with those pharmaceutical companies, and then they market their product.
Provide a platform for.
Yeah, so a platform for the pharmaceutical companies also to promote their products.
Okay. Fair
And
enough.
for doctors, in a way that they could, if possibly, if they are collaborated with somebody, they get the opportunity to speak with them on their webinars or things like that. So it's like a closed community, but specifically for doctors.
Okay. So how did you get into digital marketing in the first place itself?
So during my MHA, I actually got the opportunity to work for a pediatric hospital.
Okay.
So over there, I was with the marketing team and a little bit of operations, but mostly marketing. So over there, I realized that, there's so much scope when it comes to so over there, I did not really specifically do anything with pharmaceuticals, but with doctors.
Okay.
So we were doing marketing for that particular hospital. So learning that, I understood that what kind of various media can be used for what specific organization, basically.
Understood.
So that's where the interest started, that okay, marketing went in there, and then that's why I was like, okay, and then I got this opportunity to do digital marketing specifically. So
you did your MHA in US and then you came back. Were you all? So I mean, any particular reason why you came back, or there was none?
COVID.
Okay, the pandemic.
Yes,
It
the
affected
pandemic
everyone.
hit us all. I feel like pandemic teaches us so many. So it's just taught us so many things.
Right.
So there were different plans before, but the pandemic changed the plans.
So when you came back, did you have to do any particular courses related to digital dentist marketing?
So did a small course on digital marketing with by Google, and
Okay.
We had an internal process in the company that we got more knowledge from, and then the day-to-day work life cycle, it kind of you get in the flow and then you learn every day. So that's something that's keeping on going right now.
Okay. So you did your BDS in DY.
Yeah.
How was that experience?
BDS was fun, yeah. Like I think everybody who's done BDS with us in our batch,
Right.
it's just fun. First year, second year, third year, like what are
I
we
think you
doing?
were finally an internship. Yeah.
So it was good overall experience. Made good friends.
Were you all? I mean, you always wanted to become a dentist, or it's something which just happened by chance?
So I always wanted to become a doctor.
Okay.
Okay, it wasn't like I wasn't very specific कि मुझे MBPS करना है या BDS करना है. I wanted that doctor title in front of my name. And my family dentist kind of influenced me, I feel, because I've had dental issues. Like I used to go to him for ortho, and just going to his clinic so many times, I saw the kind of work that he does and the way he interacts with his patients and how he has no emergencies. And if you say that something's hurting, he'll be like, हाँ ठीक है, कल we'll book an appointment. It's not necessary that आज ही आना. I was like, this is great, yeah. You don't have any emergencies. Dentistry is something that, and then there's a lot of skill also involved, na? And I also like art, so having that artistic skills, including it in that.
So he influenced you big time.
Big time. And then I don't think he knows that he influenced me.
Now he knows. Now he'll know.
Maybe, but yeah, he did, and then that's why dentistry.
And was it just the the non-emergency part, or you just love the whole ambience of a clinic and sitting in a chair and working in your set timings and
Yeah, everything. It's like a package, like your own set timings. And I feel like it was more of interacting with patients. Your patients are not like...
You also mentioned to me one particular thing which you liked. Because that's a very peculiar thing, and it's one of the first time I've heard someone say that, and it's very interesting.
Yeah, just the ambience and the instruments and everything, the noises, the smells, everything. It just gives you a different atmosphere when you go to a dental clinic, I feel. You're in a dental clinic. I don't think you can be somewhere else and think that this smells like a dental clinic.
Yeah, you enter and you're in a dental clinic.
Yeah.
So what were the things which you did in your UG days and that has stayed with you till now?
UG days, I feel like communication. I feel like the basic...
The The communication
ability.
with the patient? No.
Yeah, communication with patient, teachers, anywhere. Like every.
I feel you also you feel you meet us so many people from so many different backgrounds in during UG days, your friends, your colleagues, that it also teaches, like you said, it also teaches you how to communicate with so many people.
Yeah, and then just understanding, like Karam also said, I think that it kind of teaches you patience.
Right.
Yeah. So
And that's true. That is very true.
It does. Patience is something that, and it takes you aage also. Like I feel even after MHA, even in working in corporates also, you require a lot of patience. It's not just when you're working with a patient. So that's something that I've learned from.
Anything you wish you did more of in your UG days, which, I mean, not particularly any regrets, but something now when you look back, you think, I should have done this more when I was in my undergrad days.
Actually, I was not very ऐसे घूमने फिरने वाला है. So I feel like I should have done that more.
So you feel you should have, gone out more and everything.
I feel like I should have gone out a little more.
Because now, even if you have the time, you can't, because there's so many responsibilities, and back then we had none, honestly. So.
But we used to think that we have so many responsibilities. But we actually had none. But yeah, I feel like, so I was not a very studious person, but I was not a very bunking wala person also. I don't remember bunking a lot of classes. Somewhere in the middle. So I feel like I could have had more fun and gotten away with it.
Okay. Any special memory or funny incident or any incident which you remember from your UG days which you would like to share with us?
I feel like Shivam had the maximum attendance, the Shivam restaurant in front of us, and I feel like his Nimbu Pani and dosa was like something that was...
I know so many people who have come to college, have not attended the college, but full day they were in Shivam. I mean, घर पे बोल के गए कि college जा रहे, and you find them when you go in a break, then Shivam. When you go after college, then Shivam.
Yeah, I don't know what they would do all day, honestly. We used to only go for breakfast.
But the uncles, they are very friendly, and and they actually showed interest कि तुम लोग क्या पढ़ रहे हो, क्या कर रहे हो, like
They knew a lot. That Xerox wala also behind that Shivam used to know everything.
Yeah.
He knew even before you went to the next class कि हाँ अरे ये तुमको तो लगेगा ही.
I feel he could have been called like a guest lecturer also, and he would have given a proper lecture in dentistry.
100%.
So the whole Shivam thing is something which you remember a lot right now.
Yeah.
Anything which, like for example, someone who wants to do dentistry right now or are in their first or second year, what would your advice be for them?
My advice is that if you like dentistry, you keep doing it. Mm-hmm. But if you don't like it, by the time it's internship, don't waste your time. You can have other options open.
But how do they do that? I mean, according to you?
I feel like internship mein you kind of realize what clinical specification you like and what you don't like. And that is when you actually decide your trajectory ki kisme MDS karna hai, kya karna hai. I myself took 2 years of practicing dentistry. And I absolutely love oral surgery and prosthodontics. Okay, till date I do miss it, and someday I feel like even if I want to, I still have that opportunity open that okay, I want to go back to practicing, I can go back to practicing. Right. Your degree is never not valid.
Right.
So I would just say that explore your options. Mm-hmm. Don't just be stuck with something that you think is going to work for you. Something else might also work.
So any like one high and one low point from your UG days?
Highest point I think would be that doctor title.
Convocation. Like you get the degree and your...
because that was my whole idea of becoming a dentist. I always wanted to be a doctor. So having that first visiting card, chapa hua Dr. Unmesha, it's like a good high moment for me. I still keep that visiting card with me. I still distribute it sometimes. Lowest point would be that I think in first year only, you're so overconfident about everything. Ho jayega, and you get a KT and then you're like, oh shit, what just happened? So that one KT actually changed my trajectory towards the whole course. But no, not exactly a low point, but somewhat a low point.
But how did you overcome that? Like you said, you were, say like overconfident that हो जाएगा and then वो नहीं हुआ. So how did you cope up with it, like mentally?
Just ज़मीन पे आ जाओ थोड़ा. Just be like, okay, breathe and start doing what you have to do rather than just thinking that you can do everything.
One of the questions was that which you answered is like, if given a chance, would you go back to clinical dentistry and get in? But then you already answered that. But any particular reason like you feel you can go there?
I feel like, see, now with MHA, corporate, everything, it is good. But I also know in the back of my head that, I somewhere want to practice clinical dentistry. आगे जाके. But with this experience, I feel like I can do both. I can, if in the future I get the opportunity.
Because in your family, a lot of people, I mean, friends, family, they know you as a dentist, so they must be, consulting with you still.
Yes.
So how does that feel?
That is good. I feel like I'm always the second opinion of all of them, and I'm like that validation point for them. कि हाँ ठीक है ये बोल रही है तो हाँ ठीक है इधर जाते हैं. And also that they trust me because we have made such good colleagues and we met such great professors and we have all of these people in our network, so we know where to direct these concerns.
And they know you will, direct them to the right person.
Yeah. And then that trust also makes you feel good, na? So that's why maybe.
But does that also make you feel added responsibility that itna pooch hai, so let's wear the gloves, let's go back and practice again?
Sometimes I do. Sometimes, so like since I'm not actively practicing, so sometimes I'm like, अरे यार तुझे सिर्फ scaling की ज़रूरत है, and then I still have to send that person to somebody. I'm not doing it myself. So that's why, that is one reason that, general dentistry is something that I can do.
So you can still open a clinic or
maybe,
a small room of yours and
Maybe it's in the plan. See, degree is never going to go
waste.
Non-valid.
Yeah.
So there's
always. I'm sure a lot of people will just come with a name. Because that happens when अपनी कोई family में कोई dentist doctor, but the first thing is to go and visit them.
Yeah. No, it is definitely in the plan.
And you also make a lot of reels. Recently, I'm seeing you with your husband. So how did you guys, get into this craze of making reels?
It was just, I don't know, it was just out of the blue, we started.
So you just made one and it clicked and that's why you kept on making, or is this something which you guys have planned? Like, some people have that. They want to become a social media person. Like, was it an active thought of doing this for a long time, or is it something which you just did and it clicked?
So honestly, it started with something just random, But as we went through it, like every week we were doing something, and then the response was good, and it started clicking. A lot of people think it's relatable content.
Right.
So now we are not giving it up because we want to keep it consistent. We want to keep it consistent because maybe in the future we can monetize on it. You never know what will work for you nowadays. So, yeah.
So, like, how much time goes in shooting one reel or one episode? Because what we see is just a 30-second or 60-second clip.
Yeah.
But what goes behind the scenes? Because there are times where you're fighting in the reel. So, how many takes, or roughly how much time does it take to make one?
So sometimes it's just once. Sometimes it's like 20 takes.
In one shot?
Sometimes it's like 20 takes.
20 takes? so which was that reel which took 20 to...
I don't remember now, but there are some wherein you're like, okay, the camera doesn't sit right.
Yeah.
Or, you see some shadow randomly behind which you did not observe. So some of those things. But we try and make it like it's mostly impromptu. And I feel like the ones that are more impromptu actually click better than the ones that are planned. So we just... Because
it's just not you two guys in the reel. There are sometimes, passengers and people in the gym and your family. So even if y'all both are doing great, there are times where, the other person can screw it up. So which might lead to more retakes, So the fact that y'all have to take care of everything and, it looks easy, but when you actually go out there to shoot it, it's quite difficult. And you guys are doing it every week now, once every few weeks. So that's crazy enough. So what's the thought process when you decide to make a reel? Do you talk about it, discuss it, or you just start shooting it? I mean, what's the thought process behind making one?
Honestly, sometimes it's like we are having a random conversation, and it sometimes ends up being funny, and we're like, this should be a reel, yeah. So
now whenever in your daily life also, now when you're just sitting, you're talking, and you're like, can we make this into a reel?
Yeah, sometimes we do.
Wow.
That's what I'm saying. Now that it's clicking, and since it's being consistent, we would like to monetize on it, So that's why having that in the back of the mind is always there.
And how has been the response from your family and friends?
Oh my God. They think some things that I can't say, really, honestly. Because they're like, abhi shaadi hua hai. What all you're making him do? Mama, it's only for the reels. But yeah.
But it's fun because you can relate to it.
Yeah. And I'm very glad that my husband is
He's a sport.
He's a sport when it comes to this. My in-laws are also a sport in this. Sometimes they're actually shooting content for us. So it's fun.
And it's just not random things. You all actually act.
Yeah.
There are times, facial expressions and everything. So any crazy idea of a reel have you guys thought of, which you might make in the future?
Thought of many things. They're coming soon though. I can't tell you. But it's all relatable.
Anyone which you think it's crazy, but you cannot make it?
Dude, there are quite a few, but
you have to look at all the things and...
Yes, you can't offend someone. You can't offend anybody. In fact.
Because what I get is, if they are doctors, how do they get time to do all this? But if you do something, they'll say something. Even if you don't do something, they'll say something. Yeah. So rather do something, and that's how the world works right now.
That's true. And I feel like if you have to make time for something, you do make time. If you genuinely want to do it. If you don't want to do it, you'll find reasons to not do it.
When I think about content, there are times where you might have given a lot of effort into making one and it flops. And there are times where randomly you're talking to your husband and you're like, let's make a reel. And you make it and it clicks. So how do you guys deal with it? When you put a lot of effort, it does not work. Not all the time, but sometimes. And there are times where you don't put any effort and it just works. So how do you guys deal with that? Or have you all even thought about it?
No, I feel like right now we are more focused on the consistency. So rather than looking at the numbers and getting upset about it, or just getting happy about something that clicks, we are trying to be focused on keeping up the continuity rather than...
That's a good point.
Dwelling on something.
Yeah, because you would rather focus on putting out more content than focusing on numbers and feeling bad about it, because we don't know how the algorithm works right now.
Exactly.
But a lot of reels are shot in the gym. Are you an active person who work out daily?
Yes, I try to.
Is it because of your husband right now, or is your husband working out because of you?
It's mostly... So I started working out because of him.
Okay.
But then now it's a consistent process. I feel like it's something that is essential in your lifestyle. And even if it is an hour a day, at least 3 to 4 days a week, it should be... It's good for you. I'm not into bodybuilding, or I'm not into insane diets or insane this and that. But just to keep your lifestyle a healthy lifestyle, I think it's important.
Any particular regime do you follow, or it's nothing
So I focus most... So I do CrossFit.
Okay.
A little bit of MMA. Twice or thrice a week. And then your own cardio, running and stuff like that.
Any particular diet you follow in all this? Or you...
No, dude, if I was dieting properly, I would have been like a model. No, Not dieting. No specific diet for that matter. Yeah, just ghar ka khana, and sometimes outside.
Because when I ask Karam, he follows he follows religiously.
He is a different level of commitment to the diet. Like, it's not affected me though. Like, I feel like,
So how do you balance that when one person is on a diet and one person is eating not on a diet? How do you guys manage it out?
so basically when I say that I don't do a specific diet, but it's
No, of
not,
course I understand. It's not that you eat anything. You also follow, because I understand वो हो जाता है एक दूसरे से, like influence आ जाता है. But it's just that he follows a very strict diet. What I've seen and what I've heard about him.
yeah, his is more about measurements and numbers and grams and this and that. Mine is more like quantity and quality. It's like a balanced meal. So if I'm hungry, I'll eat. I won't starve myself.
Got it. So when you work out, you're also working out with him. How's that like? Working out in the same gym as him, and
It's good and bad. Good for me.
okay.
Sometimes I annoy him a lot. So he gets bothered.
He doesn't like to get
He likes his own space when it comes to working out. But yeah, even I like my own space. And when I'm doing CrossFit and all, it's like a group activity. So it's fun that way. So we both usually go to the gym together only.
Okay.
Sometimes I leave before him, but we go together.
Got it. Any advice would you like to give someone who wants to start working out?
I would say
Irrespective of any age or gender.
Okay. I would say start slow.
Okay.
If you've never worked out, don't just go and start running 5 kilometers a day. Start walking, start running. Then, eventually incorporate your diet that way. Have a healthy meal. Don't have erratic meals, midnight snacking and this and that. Otherwise, there's no point of working out.
Right.
Diet plays an important role. Actually, if you're eating healthy, it'll be more beneficial. So just start slow and be consistent.
Got it. Last point on this. What changes have you seen in yourself after you've started, being more active and, going to the gym regularly, being consistent at it, following a proper diet? What changes have you noticed in yourself?
Overall health, immunity.
Okay.
Touch wood, I don't fall sick as often. Because of that. Your clothes fit well. You feel good about yourself.
And mentally
you're at peace. You're more focused at whatever you do. So I feel
and
exercise helps.
And also while working out, you get more ideas about what content you can make.
Yes, more content ideas.
Because they are one of the more relatable, and because I know both you guys, it's even funnier. It's entertaining, yet you have a good laugh. You don't find it. You don't laugh because you find that stupid. You find it puts a smile to your face. And my mother watches your reels. A lot of my friends watch your reels. Like I've introduced your reels to them, and now they update me saying, "Arey, tera friend ka ye aa gaya reel." So
that's so sweet.
People are liking it. So I think y'all should go at it. And like I said, when you add that option of monetization, it actually gives you another incentive to do more about it.
Yeah.
So
it didn't start that way, but it's definitely going that path.
I really wanted to ask you about that, but I'll wait till Diwali to find what reel are you guys making. So we have a new section called the rapid fire section.
Oh, okay.
Where I ask you questions and you have to answer as fast as possible. Your favorite BDS posting?
Prosto.
That's the first time someone has said prosto in this podcast. Why?
Really?
Yeah.
I don't know. Yeah, I liked prosto. I liked crown preps. I like the whole aesthetic part of it.
You love the whole department also?
Surprisingly, there were a lot of issues with one particular person in that department, and that person used to like me.
Wow.
So I had no issues.
It can't get better. Best part about being a dentist?
That you are a doctor, but nobody comes with you with an emergency. Comes to you with an emergency. And you...
But that's only until they realize you're a dentist.
Yeah.
But if you said... there are times when they know you're a doctor and they I know few friends, a lot of patients have landed in the clinic saying कि आप डॉक्टर हो ना? So like हाँ डॉक्टर हो but दांत का हो. So like emergency था वैसा. Like you know like non-dental था. But they just assume कि वो ये था ऐसा. So according to you, that's the best part about being a dentist, that you don't have to...
Yeah, and that you're a family dentist regardless of you practicing or not.
So I think it's good, right? Because they still, refer to you before they start any treatment. They come to you for second opinions.
Yes.
And it's great. I mean,
I feel grateful. Yeah.
That also might, push you towards, coming back to clinical dentistry at some point, of your life. Your favorite restaurant?
Recently, I'm a fan of this restaurant called as Origami.
Origami.
Yeah,
where's that?
In BKC. It's quite
what
nice.
You like?
It's a Japanese restaurant. It's very nice.
I think I'd seen a story on that. It's got that origami like architecture.
Yeah, slightly. Like they have like these hangings and stuff, and there's like a sitting, like the proper Japanese sitting.
Mm-hmm.
It's nice. The food is also nice.
So you love it for the design and the whole Japanese art and
the food. I'm actually fond of Japanese food.
If you were not a dentist, what would you be?
Pilot.
A pilot? Like a commercial pilot
or a commercial pilot. I feel like that would have interested me. I don't know.
So you had that option of becoming a commercial pilot and you shifted to dentistry after meeting your...
So for that I had to do math.
Okay.
And I was not good at math. So I was like, no.
Okay. This one is interesting, but 5 most used apps on your phone.
Obviously WhatsApp.
Okay, that's one.
Instagram.
But obviously 2.
Yeah. Facebook.
Which you use every day. 5 most used apps on your phone.
Yeah, Facebook is something that...
Facebook, that's 3rd.
My office apps.
Office apps?
Yeah, the communication.
The document, yeah. That's 4th.
Yeah.
Last one?
One photo editor that
I was actually waiting for you to say something like calorie, something like related to...
No, that my watch does. It's just health app. Yeah, the health app.
Any health apps. But that's great. You don't rely on apps for health. That's actually good. Yeah. So the 5th one was the... what was the 5th one?
Dude, what did I say?
I should have forgot. Office app ke baad 5th was your...
Dude, really?
Which was that app?
Photo editing.
Photo editing. I'm sorry. Photo editing. Photo editing.
Also photo.
Can I know the name of that app?
No, it's a very random app, dude. I also don't know the name. It's just
wow.
It's very random.
Okay.
I would say health app then, yeah. Health app. Only when we make reels is when I use that.
Okay. Your favorite reel out of all the reels you guys have made?
So my favorite one is the one where I say to him that, अभी तो शुरुआत है, अभी तो तुम्हारा golden period चल रहा था. इसके आगे क्या होएगा?
So that's a favorite because it's true?
Kind of.
I'm sure you enjoyed a lot while making that video.
Oh yeah, so much.
Fair enough. One thing you miss about US the most?
Cleanliness. The whole environment, actually, and the kind of individualistic responsibility that you have.
You miss that?
I kind of miss that because you are so focused on what you have to do next. You're, maybe it'll change a few years down the line, but this is during the college time what we used to think.
Right.
And the other thing that I miss is just the, some of the best Mexican restaurants are there. Oh my God, it was amazing. I don't think I've had Mexican food like that in India at all. Great Mexican food restaurants.
Just to add my point on that, isn't Mexican food more like the chaat what we have in India?
Yeah, it's very different. We think यहाँ पे we get those nachos like that, like chaat.
No, the taco. I think it's because what I've eaten Mexican in India, probably if you eat authentic Mexican, that's completely different.
Yeah, some things are, I miss that. The flavor and all that.
Last one. One food item you can eat anytime, any day.
Pani puri.
Pani puri. Any particular place you love to go to eat pani puri?
There was one local place next to my house.
Okay, in New Bombay.
Yeah.
Do you still? You still eat, right?
Yeah. I wouldn't mind it for breakfast, lunch, dinner.
That's great. So that's about it for us. Thank you so much, Dr. Unmesha, for this time. For your time, it was a short one, but it was lovely knowing few things about digital marketing, something about MHA, a lot to do with your reels, because that's something which a lot of people keep asking. I'm sure must be asking you guys. So this podcast might answer a few of them. We'll again have you soon on the podcast. And
thank you so much.
Thank you for your time. Come all the way from another city.
Thank you so much.
So thank you so much, and we'll again have you soon. Thank you.
Thank you. कितना टाइम हुआ?
नहीं वो उतना नहीं है.
हाँ.
It's 42 minutes. Liked it?